who are Californians who love to start off the conversation with telling me how great the weather is. I don't hear that anymore.
Yeah.
I like to tell them that I just watered my lawn, washed my car, and took a 2-hour shower.
Mike, I just saw a pop-up that this is being recorded, so hopefully.
It is. I made it. Sorry, guys.
Good. All right.
That's my fault.
So
Okay,
we can start
we
officially.
can start. And I apologize.
So it's my pleasure to call the September 8th meeting of the Skokie Board of Health to order. The first order of business is to approve the agenda that was submitted to us, and we'll follow what we've done before on the Zoom, and we'll accept everything unless we hear to the contrary. That anyone opposed. And the next thing is the approval of the minutes from our June 9th meeting. So that was the last time we convened. And we actually can do an official approval today.
Great.
Do I have any discussion points? Any deletions, corrections, abbreviations, punctuation? Well, I will accept them as submitted, Mike. Thank you.
Great. Thanks.
So I just want to start off with a very brief chair report. And Dr. Werner, who is able to join us tonight, thankfully, has a brief announcement that he'd like to make to the board.
Yeah, thank you, Dr. Lynn. Back in March, when I was facing a series of fairly arduous medical procedures, I submitted a request to the mayor to go on medical leave as chair. And I wanted to see how the next 6 months would proceed. So, well, now we're at 6 months. And I'm happy to report that my most recent bone marrow tests show that I'm free of leukemia. However,
Wonderful.
the chemotherapy has been so aggressive, it's really done a job on my bone marrow. So I'm severely depleted and immune compromised and at risk for bleeding and bruising. And so I submitted my letter of resignation to the mayor and the village manager because going into the fall activities now, I don't think I could really actively represent the board to the village and to the trustees and to the health department. I'm asking to remain on the board as an active member and participate as best I can. But I really appreciate all the support that I received from you folks. And hopefully going forward, I'm going to recover some of these functions. So thanks.
Well, I want to thank you. You've been a wonderful leader and a friend, and have helped me assume some of this responsibility. I know that the mayor and the village trustees will be working on finding a suitable replacement. And Mike may have a little more to say about that. And I also know, Bill, that we will in some way have a formal recognition of your contributions in your role. And I mean, we understand that you're not going to be doing any in-person meetings. And so we will make sure that we get it to you.
Oh, well, thank you very much. I appreciate it. Yeah.
Yeah, and I want to, if you don't mind, Dr. Lynn, I just
No,
want to
go right
say
ahead.
one or two things. Is that, when I started off as the director back in November of 2020, one of the first individuals I actually had the pleasure to meet was Dr. Werner. We were in the midst of some change, and we needed a medical consultant for the health department. And without hesitation, Bill jumped in and still to this day serves in that capacity. And he's also one of the first individuals that I met through the Board of Health. And ever since day one, he's been a pleasure to work with. I mean, you are one of the kindest, smartest individuals I've ever met. And your compassion for public health is just amazing. And I think that I can speak for everyone on the Board of Health that we all appreciate your leadership. So thank you so much.
Oh, thank you for that. Yeah.
Yeah. And I don't know, Dr. Lynn, if this is an appropriate time, but I have recommended Dr. Lynn to continue on as permanent chair to the mayor. And I believe the mayor is going to accept him to be appointed as permanent chair effective, I think, Monday, September 19th, I think is the next board meeting. So I think Dr. Lynn has done an amazing job with Dr. Warner going through his treatments. And I also want to recognize that he's done a great job. And I really look forward to working with Dr. Lynn too, since I've really enjoyed my time spent with him also. Thanks.
Well, thank you. I really appreciated being able to be on the board. And I know this has been a very difficult time for us to have the usual type of business. And I know that Bill and a number of members of the Medical Reserve Corps and the board is well represented in that, have done really wonderful things over the last few years. And so I'm proud of the organization. I've lived in the community. Actually lived in the Skokie area. I'm in the 60203, Skevinston part of it since 1978. And when I was approached a number of years ago to consider being on the board by Dr. Mickey Drackler, I just was too busy, and I really didn't have a lot of discretionary time. And when I retired from my active administrative and clinical roles, I revisited with the mayor, and that's when I was appointed. And I still feel very impassioned about the fact that it gives me an opportunity to give back to the community that I have kind of enjoyed all the benefits of being part of, and hope to be able to contribute any way that I can, for in this world. Right now is very challenging on many different levels. So again, I thank Bill, and I'm going to move forward a little bit because I want to get on to the rest of the presentation in a moment. I asked Mike to send out a little reminder, and today you should have received an email where there was a link. And I know many of you may have not had a chance yet, and many of you may not have had a chance to look at your email, because in as you all know, a number of weeks ago, the CDC sent out streamlined recommendations for COVID-19 guidance, and Mike and his team summarized it really nice in a one-pager, and that's what that link is for you. But I have been involved in some COVID education programs. That's what I do. In my free time, and we noticed that the way the media has been reporting this, and this maybe fits into what we had touched on, before the meeting formally started, but this idea of COVID fatigue. But for many people, there's this perception that we're done with COVID, and it's the furthest from the truth. And as I like to remind them, you may be done, but COVID is not done with you. And the guidelines were really streamlined to fit a need to try to make it overly complicated. The way the media reported it, though, and I'll give you just an example, and you can look at it in more detail. This idea about post-exposure, that you no longer need to quarantine, and the justification for that had to do with the fact that we have what we call an immunity wall. Across the nation, about 65% of people were fully vaccinated, and another 40% of those folks actually received their boosters. It may be up a little, maybe even over 50%. Not much higher than that. And as we all know, with the Omicron variants, a lot of people got sick. And so they estimate that 90+% of people have either been vaccinated or infected. And so there is some immunity. And the prior recommendations from the CDC, they differentiated between those who were vaccinated and those who weren't, and they had separate pathways, and they kind of simplified it. It's true now you don't have to quarantine, but you still need to wear a mask for 10 days. You still, it's recommended to get tested on day 5 after exposure, known exposure now. And that has been lost in translation. And so the reason I'm bringing this up now, there's some other points as to, when you're convalescing from the infection, what you should do. This mystical 5-day recommendation really came out of healthcare workers. The reality is people shed virus longer and could, and this whole idea of masking and avoiding contact with individuals that may be immunocompromised, all that was left out and how it was reported. And I just want you to be armed with this so you can, again, be an ambassador, if you will, for the health department. And, talk to all those people in your sphere of influence and try to be able to answer the questions. And, we're going to try to get these words out, but I'm not so sure if the public in general reads the material that's being sent out. So we're really kind of at a challenge a little bit, and we want people to understand it. And so that's why we sent out this link, so you'll have a chance to look at this in a little bit more detail. The next thing on the agenda are the presentation regarding the Health and Human Services Vision and Hearing Program. Mike, I'm not sure who is giving that. Now I know. Thank you. If you're speaking, you're muted.
Okay, so I'm not sure if everybody remembers this, but at some point last year, Ed and I meet once a month outside the meetings, and I think we had discussed that it would be beneficial, like at least every single Board of Health meeting, for us to present one of our health and human services programs in a little greater detail. And when we sort of mapped out the calendar, it's, if we present one program per meeting over the course of a year or two, we're going to get through all of our programs, and then maybe we can just recycle them so that any new members will get to learn about the programs. So on the calendar this month was an update on the Health and Human Services Vision and Hearing Program. So I thought I would provide a little bit of information about this. Now, I will say that in regards to presentation time, this isn't going to be one of the longer topics, but it is important that I gotta move to a different screen here. It is important. It is an important program to the village. So let me first talk about, so vision and hearing screening is actually a requirement under the Illinois Child Vision and Hearing Test Act. And what this act says is that in public, private, and parochial schools, it's required that children ages 3 through 12th grade at various frequencies, don't ask me to verbatim what it is, but it's like 3rd grade, all children need vision and hearing. 5th grade, all children need vision and hearing. 10th grade, they need this. Is that schools require that the children get tested for vision and hearing. The act also says that anybody conducting the vision and hearing screenings need to be licensed through the state of Illinois to make sure it's a standardized testing procedure, a screening procedure. So the village of Skokie Health and Human Services Department has been for over 25 years providing vision and hearing screens for licensed daycares, preschools, and private schools. Our public schools are fortunate enough to have their own vision and hearing licensed individuals who provide vision and hearing screens. So we historically haven't had to provide that service to the public schools. We currently have approximately 24 private schools, preschools, and daycare centers, which we provide screenings for. And we conduct a little over 4,000 screens annually at those schools. So prior to 2022, we had an employee who was a full-time employee who was responsible for many years to conduct the screens. Well, this employee retired, and because of attrition, we took a look at whether or not we wanted to hire. And this, by the way, this person, this full-time employee, was doing more than just vision and hearing. They were also participating in several other programs for the Health and Human Services Department. But just like any position with the village, anytime you lose somebody because of attrition, you got to take a careful look at whether or not it's necessary to rehire or if there's another option. So I ended up meeting with myself, the village manager, the personal health supervisor, Sue Riesberg, and we took a look at, instead of hiring back someone for this, potentially hiring a third party licensed contractor out. And what we did is we receive about $15,890 a year through a vision and hearing grant from the Illinois Department of Public Health. And when you take the amount of money we're receiving through that grant, and we started charging our private schools for school age. Now that grant only covers preschool age children. So anyone school age and higher, we don't receive money through the grant. So what we decided to do is we actually reached out to the schools several years ago, actually, and asked them if they would be opposed to us charging them a small fee for the service. And it ended up where the small fee that we charge is actually less than they could pay someone else to come in. So every school that we ended up charging a fee for has accepted it and is more than willing to continue to use the vision and hearing service. So it's a win-win for the village. We actually saved some budget money by eliminating a full-time staff. We're hiring this vision and hearing contractor, and it's a budget neutral position. The money coming in at $7 a screen goes out to the contractor at $7 a screen. There is some minimal administrative stuff we do to still support it with our internal staff. But in a nutshell, that's it. And with the vision and hearing program, essentially what occurs is that we screen all children in every grade when it's required. If a teacher refers a child into the program that might be not within that age group, we'll also screen them. If we screen them and we find that they fail the screen, or there's something that requires some additional testing, then we refer them to a private audiologist or a private, a physician's office where they, or an ophthalmologist, where they can actually get an official full eye test or a full hearing test. And then that provider would then provide them with whatever they need, whether it be glasses or hearing aids or any type of hearing devices that will help that child. So, like I said, that's like a quick one, but does anybody have any questions about the program?
Yeah, Mike, I've got a question.
Sure.
When you do screening tests, it's important to do a follow-up. If these students are referred, out into the private sector, do we know how effective that follow-up is? Are they getting effective interventions?
That's a great question. I don't have an answer to that right now, Dr. Warner. I don't know if it's something that the technician we're currently using is following up on. I'm assuming she is, because what she's doing is she's sending a letter to the schools, and then I think the schools then are responsible for notifying the parent or guardian and doing the follow-up. So I don't really know for sure. You know, it's not us sending the letter, it's the school sending the letter to the children. And I'm not positive of how well the schools follow up.
Yeah, as I understand it, so you're providing the service for the school. Because the law is really directed to the schools.
Mhm.
And so I would think that they should be responsible for following it up. Might be interesting just to find out if the loop is closed, because it is an important point.
Mike, can't you just ask the village attorney to research the law and tell you what the Board of Health's obligation is outside the implementation in the preschool group?
Yeah, I don't think the Board of Health has any responsibility over this particular program. I think this is just more for information than anything else.
I don't understand.
Oh,
Why are we involved?
well, I think what happened, Maureen, is that we decided at every meeting that we would present a different program area that the Health and Human Services Department manages. And it's really just a more informative, just for the Board of Health to get to know the programs a little better.
But someone on the board has raised a concern about follow-up when a child is identified as needing follow-up. And so you could just ask the village attorney, do we have a responsibility to do?
Oh, okay.
Or if it's a licensed individual, is the onus on the parents once they've been notified that that child
Yeah.
has hearing or vision deficit that needs to be attended?
Yeah, well,
So
yeah,
I'm-
yeah. Okay, well, what I will do though is I'll reach out to our hearing and vision contractor and then work with them through the schools, and I'll figure out what the proper procedure is and how it's handled.
I saw another hand go up.
Yeah, that was me. I know Village of Skokie was doing a hearing test for adult also a long time ago. With the person retiring, are they still offering that service to
We are
adult individuals?
we are no longer offering that service now.
Thanks.
Any other questions? Thank you, Mike. So I guess we can segue into your next presentation, which is kind of an update as to what's been happening in Health and Human Services.
Sure, yeah,
The date on that slide,
that's wrong.
I'm assuming it was,
It's just, I didn't update the date.
okay,
It should be today's date. So, yeah, I mean, I've always opened up with COVID, and at some point I might switch it back to updating everybody on some of the other things we do really well. But for now, I'll start off with COVID. So COVID cases in Skokie over the last 2 months now, 3 months since we last met in June, have actually decreased, believe it or not. I actually ran our data. You know, I can run the data off of our I can download data from the state's, it's called the Salesforce system that tracks all of the positive cases that are actually tracked, which is not as many cases as are out there, of course, because I think most people are testing positive through at-home antigen tests now, but at least from the data I have available to me, our community transmission rate, which I have a slide about 3 slides away from this, was down below 100 for the first time for several months. So that's the good news is at least in Skokie, our community transmission rate's decreasing quite a bit since then. And I hope that trend continues, but they're estimating that the fall, they've tended to see the bell curve go up for COVID over the last year or two. So we'll see what happens. So the community level, which is the CDC's measurement of your risk of COVID in your community, and this is based on Cook County, is now at medium. It was at high. It's at medium primarily because the transmission rate's still high in Cook County, but the hospital system isn't overburdened with cases. And because of that number with the hospitals, we're at medium instead of at the high level. Our community transmission rate has decreased from 342 new cases per 100,000 to 94 new cases per 100,000. Like I said, this being below 100 it's been a while, and I'll open up the graph and I'll be able to show you exactly since when. Our 7-day moving average number of cases has gone from 38 cases a day to 9 cases a day. Moderna, since our last meeting, Moderna and Pfizer have received approval for 6-month and 5-year, and we are administering the Moderna dose. Moderna and Pfizer received EUA approval for their bivalent booster vaccines. We all know about that. We received our bivalent vaccine yesterday. We received 200 doses, and we will start administering the bivalent booster to Skokie residents at the next Tuesday's Moderna adult vaccine clinic. So we're busy updating our website, and we'll be promoting it to people. But we are not going to reopen the mass vaccination clinic. I think earlier, Dr. Warner or somebody was saying that Walgreens has, or I think it was Rohit was saying that at Walgreens, you can currently get the vaccine. So, but we will be opening clinics on Tuesdays. And I think after the 13th, I think we're going to open up clinics on Monday mornings and Tuesday mornings to try to accommodate additional individuals. Like we had just discussed, the isolation and quarantine guidance was updated on August 11th. And just to piggyback on what Dr. Lin was saying, that the CDC, not necessarily on the isolation and quarantine page, but they had a more like scientific response to it, was saying that they acknowledge that COVID-19 is still high, but because of the high levels of vaccine and the infection-induced immunity that's currently present, along with what they're saying is like effective treatments and prevention tools, it's really reduced significant illness and significant death. And what they said is that all of this allows the CDC to minimize like public health interventions and reduce barriers to social, educational, economic activity to reduce those things. So they're looking at everything, and that's the reason they made this decision. But like Dr. Lin said, I mean, the number of COVID cases now is still high, and there's still a risk to individuals. So we're administering only Moderna doses. This is kind of a really busy slide, but essentially we're offering it for every age group and any possible booster or first or second dose somebody can get. We have administered over 33,000 doses. Skokie has about 20,000 cases. Total deaths is about 208. I think back on June 8th, when we last met, we had 204 deaths. So we've had 4 deaths since June 8th. So there are still people dying, but it's not at the rate the first year or so of the virus for sure. This is a chart. I don't know how big it is on your screen, but you can see that, recently we've seen sort of a downward trend in cases. I didn't have the time to take and look up what the trends are in Illinois, but I'm guessing it's probably pretty similar across the state because these graphs have always almost mirrored each other. This is the transmission rate graph. Now, this is just one of the things that the CDC considers with the COVID level. So you can see, it's hard to see here, but actually there's, you know what I didn't do is when I did this, I didn't extend the timeline here. I apologize. But either way, if I did extend the dates in Excel, you would see that the number, this red line is actually turned into an orange line, which means we're in substantial community transmission. So that's my COVID update. Does anybody have any questions about COVID before I move on to some of the other things?
This is Larry Williams. I apologize. I thought it started at 7:30, so I just joined.
That's fine.
Sorry.
Okay, well, welcome. So here are some other updates, monkeypox. So the village of Skokie, we've had 3 monkeypox cases. All 3 cases have been men having sex with men, which is very common at least through this point with this disease. Our first case, all 3 cases were identified as close contacts, and we worked with these individuals originally to get the Jenios vaccine for one of them, but he ended up getting COVID anyway. He ended up getting, sorry, monkeypox anyway. The other 2, we helped them get the proper antivirals and treatments. We did administer Jenios to the first individual, but we have an agreement with Cook County now to administer the monkeypox vaccine to individuals. And you might ask, well, why aren't we doing it? Well, it's complicated. You know, the federal government has provided vaccine to to Cook County, to Chicago, and it just makes sense. Doesn't make sense for us to keep vaccine here when we're not really sure if we'll ever use it. So if anybody in Skokie needed vaccine, we would send them to an Arlington Heights Cook County clinic, which is not that inconvenient. Since we last met, we hired we lost a health inspector like 2 years ago, and we never hired that person back. They retired, and in lieu of hiring back a sanitarian or health inspector, we again, to save the village money, we hired health inspection professionals to do food inspections. And so far, so good. I mean, they're working out really well. And we assigned them about 80 high-risk facilities. So they're busy conducting inspections and re-inspections. We did hire a Claudia Braden. Most of you know her as the past public health nurse emergency preparedness coordinator. We just recently hired Rachel Blute. She's been in different nursing positions and management, and I think she's going to do really well. I'm not even quite sure if we've introduced her to the Medical Reserve Corps yet, or put her name out there, but she only started last week, I believe. So we're trying to get her sort of orientated. She's got big shoes to fill. Claudia was here for what, 20 plus years, and she knew everything about emergency preparedness. So it'll be an interesting a couple months with that. In addition, we hired we have a new social work intern that started in August, Alyssa Russick. Alyssa is a Jane Addams, I think UIC School of Social Work bachelor level intern. She'll be with us from this fall through next spring, working with our human service staff. The I-plan process has started. So for those of you, I'm not sure if anybody isn't familiar with the I-plan process, but essentially the I-plan, I'm going to read this off because I can read better than I can explain it. But basically the I-plan process, every 5 years, as a state certified health department, we have to go through a community health needs assessment process where you collect data, you survey residents, you meet with the stakeholder team. The stakeholder team then, which is both external and internal stakeholders, then looks at all the data, looks at all the information, and you narrow potentially like 20 different public health priorities down to like a reasonable amount, like anywhere from 3 to 5, to focus on over the next 3 to 5 years. There is like sort of a timeline where we hope to submit something to the Board of Health for review in June of 2023. And then soon thereafter, it would go to the village board, where we present to the village board, and the village board would approve it. And once the village board approved it, it would go, the community health plan would end up going to the state for IDPH approval. And it is a requirement that we do this every 5 years. And it's really important to note that this is a community health process. This is not what the health department is going to be doing. It's what the schools are going to be doing. It's what the churches are going to be doing. It's what our FQHCs are going to be doing. It's what the hospital system is going to be doing. And that's why we're working with all of those groups on this particular project. Tobacco enforcement, I just wanted to bring this up. Well, sorry, I wanted to bring this up because back in, I think, September of 2021, the Board of Health, Dr. Werner and I, at the request and recommendation of the Board of Health, presented to the village board a proposal to prohibit the sale of flavored vaping products. Well, And it got passed in September and then went effective, I think, October of 2021. Well, the police department and the health department have been visiting tobacco retailers, and we have cited, I'm going to do this off the top of my head, probably 7 or 8 tobacco retail, maybe even more than that, probably like 8 or 9 tobacco retailers for selling flavored tobacco products. And just remember, this is after we sent them a letter, we visited all of them and gave them warnings, and they still continue to sell it. So I just wanted to note that 2 of the businesses, we actually ended up getting penalty fines of over $26,000 because of their non-compliance. And we're going to continue to use progressive discipline. So we go through citation process, and then we would go through potential internal meetings with them, and then potentially a revocation of license, which currently we do have one of the tobacco retailers coming to a hearing at the end of the month for revocation of license because they continue to sell and they're just not listening to us. Community flu clinics. So we're busy with community. We have the flu doses in stock. We are going to do 3 or 4 employee flu clinics for employees and library employees. But we are going to have our larger community flu clinics on October 6th and October 12th. The link is open on our village website. So anybody that's interested in getting a dose from the village can certainly schedule an appointment. New this year, we've been billing Medicare for years and years and years, but this year we're going to bill private insurance. So we are going to collect private insurance and Medicare. If somebody can't pay or somebody is uninsured, they will still get a flu shot. It's just, the underinsured and uninsured, the flu shot will still be free to them, and we will not charge those individuals. I want to talk a little bit about our emergency financial assistance program. I took the numbers from the past year. We've been very lucky through our Assist the Family program and through donations to have a somewhat robust emergency financial assistance budget. And because of that, we've been able to increase the amount of money we're providing individuals per. What happens is that with emergency financial assistance, if you're behind on utilities, rent, or your mortgage, and you meet a certain financial threshold, which is 100, and right now we're using 150% of the federal poverty level. My phone's ringing. Sorry, it never rings. Anyway, sorry about that. It's my home phone, and my home phone like never rings either. But we've been able to distribute $1,500 per family that's met the requirement, and we've been able to help a lot more households out because of that. So it's been a really great program for the community. We also have a workforce development program, which is a partnership with Oakton Community College, and Skokie Community Foundation has actually supported us by providing us some money to provide people that are income eligible to participate in about 18 to 20 hour short-term certificate programs through Oakton for free. We pay for their courses, we pay for their books, and it's been a pretty successful program so far. And we do follow up to make sure they're finishing, and we do follow up afterwards to see if they've actually received the job. And the goal is to help these individuals out who otherwise couldn't have done this themselves. So something else that's coming up, and I know this is kind of a long presentation tonight, so I apologize if it's a little long, but so we got approached by the Safe Light Foundation, which is the Safe Light Foundation had applied for a grant through AARP to provide seniors with transportation. And they approached us and said, hey, we can give you $5,000 that you can use for to set up a Lyft account and help seniors with free transportation using Lyft. So Lyft is a rideshare program like Uber. I'm not sure if anybody isn't familiar with it by now, but it's essentially with the way the program is going to work. And to be honest with you, I wasn't sure at first if we were going to do this because it's a lot of work. And it's just a pilot, and I don't know if we'll be able to sustain it long term, but I thought at least we'd try it. and then evaluate it at the end. And I felt like just with the $5,000 at about $10, $11 per trip, so that's about 450, 500 trips, it'd be worth it just to see if it worked. And individuals that are going to apply have to be 65 and older. They have to be able to get in and out of a car without assistance, because this isn't like a paratransit service. They have to submit an application, and we're going to sort of have a slow opening at first with this, and we're going to see how it goes. If it's a very successful program and we continue to receive money, and I feel like we have sufficient staff resources to accommodate it, then we may continue, but I don't know yet. I mean, it's essentially people calling the village, and we have a Lyft concierge business account, and we open up the account and we say, where are you going? What time do you need to go? And we click send. And then those individuals will get a text message and or a landline message saying, hey, the ride's coming to pick you up. They hop in the car. And it's, by the way, we only allow travel to doctor's appointments, pharmacists, and grocery stores. So anyway, I don't know if that's, I'm not looking at my screen and reading this all off, but again, it's 9 a.m. to 4 p.m. Monday through Friday, excluding recognized holidays. I mean, we haven't even started the program yet. We're going to start marketing it over the next week or so, a little bit more, but I think it's a pretty cool program, and we're going to pilot it. And like Trustee Johnson, you should have gotten a short memo on it, I think, from John. And then I just want to talk about some of the other commissions. So there are 2 other commissions that are within the Health and Human Services staff are liaisons to. And like the big things now is like the Commission on Family Services has a monthly farmers market clothing drive where they collect clothing and give it to St. Peter's Church, I believe. And then we have a weekly farmers market food drive where the vendors donate food and it ends up going to the pantry. So we get like hundreds of pounds of food every week and like hundreds of pounds of clothing that we donate every month. And then Human Relations Commission, they're working every year. They give out Black Party of the Year awards. And just recently at the June 18th meeting, they gave out the Black Party of the Year awards to like 3 or 4, 5 deserving Black parties. Grant updates, you know, we have the health department this last year had over $1 million in grant money coming in. You know, I don't think we're going to sustain that just because of the COVID money's drying up, but we just recently applied for a disease investigator grant. We're one of 21 health departments out of around 100 health departments in the state. We're one of 21 selected for this. It basically, they're giving us $100,000 a year. We had to hire someone new, by the way, not for existing staff, but we're going to hire a disease investigator to come in and assist us with COVID and communicable disease surveillance investigation, epidemiology. It's just sort of, they're going to help us. And after 3 years, if the money runs dry, then obviously that employee won't have a position, unfortunately, but it's something that we've applied for, and that position is actually posted currently. So if anybody knows anybody that's interested in the position, they should apply. We reapplied for the CRI grant and the Public Health Emergency Preparedness grants, and we will get them because we get them every year. And those are the ones that like Claudia Braden used to manage and help us become better prepared for emergencies like COVID. And then so here are some of the other grants that we did successfully apply for and get, including local protection, childhood lead, tanning, body art, vector surveillance, and vision and hearing. And I think there's about 3 or 4 other grants that aren't listed here, but we currently have those too. This is a list of what's coming up. So next month I'll have Cameron Hendricks. He's our new environmental health supervisor who took over for Bruce. I'll have him come to the meeting and present on food inspections and rat control in October. And then the last thing on the agenda for me, does anybody have any questions on all that? I know I'm going pretty quick.
I have.
Go ahead, Bill.
Yeah,
Blair. Yeah.
Mike, some communities are using wastewater screening for an early indicator or a leading indicator of infectious diseases. Are we involved in any program like that? And what kind of feedback do we get?
So I'm aware of that. We are not, as far as I know, we're not doing it in Skokie and like the Illinois Department of Public Health, or no one else is doing it in Skokie per se, but I'm familiar with it. I know it's an early indicator of disease. They used it for COVID. But other than that, I don't really have a lot more information other than that. Sort of like a sentinel, right? I mean, it's like the birds get the West Nile virus way before you detect it in humans, right? And it's sort of like a similar thing. You see it in wastewater, it starts to increase before you see it increase, and you see it people increasing with tests. So
Yeah, I'm not aware of any individual community, but I know the county is using it, and there are wastewater detection sites throughout Cook County and actually throughout the state and in the United States. And as Bill correctly pointed out, it is an emerging technique that may become the standard because it's been very reliable. And these spikes in virus that's detected in wastewater samples tend to precede surges by about 2 weeks. So it can give you kind of a heads up, which is really important, as opposed to after the fact, because that's when mitigation strategies may become more valuable. If you know that you're seeing this circulating. And I think we're going to learn more about it, but it has been a very reliable tool in the COVID pandemic, as a strategy. I know that we can actually find that being reported on the CDC website and other sources that you can actually go and see what the wastewater looks like, where they do sample it.
This, can y'all hear me?
yep, we can hear you, Larry.
Yeah. One of the things I was interested in is the last 5-year plan that I was involved with included oral health. And I hope that we can put something together as part of the needs assessment. If I'm happy to work with it and look at it and try to, get some questions added to the assessment component as to what people find and what they need, especially when you're looking at age groups. So, please feel free to let me know how I can help.
Yep, and I'll let Liz Zimmerman is our public health program analyst who's coordinating the I-Plan process, and I'll pass it along to her, Dr. Williams.
Yeah, because we can add some questions to it I've got plenty of questions that are validated, through the NHANES and different areas and other oral health areas. So we can get something with that.
Okay.
Thank you.
Thank you. Are there any other questions before I introduce the nominees for the Public Health Partners of Excellence Award individual or organizations? Okay. If not, so every year the Health and Human Services Department gives out an award to organizations and or individuals that have gone above and beyond. And these 2 organizations were nominated. And I think that they're both well deserving of the award. And Heartland Health Centers, they've been amazed. They're one of our FQHCs who have helped Skokie residents apply for state benefits like Medicaid and SNAP, and they provide accessible healthcare for all sorts of different individuals. And they've always been there. Like we have a really good relationship with them, especially Sue Reesberg, our personal health supervisor on the nursing staff, where we've always been able to work with them. They've always been accommodating and accessible. And then Kids First Pediatrics, since day one, they were one of the first providers to say, hey, look, we'll administer vaccines to children. Not only that, but when we called around to different providers and we're like, hey, are you going to be able to help with administering vaccines to children? A lot of providers are like, no, we're not getting in the vaccine business with COVID. Yet they open their arms, and anyone that we referred to them, even if they weren't originally part of their practice, they were able to vaccinate those children when we might not have been able to. So these 2 organizations are nominated, and what I'm asking tonight is for the Board of Health to accept the nominations and vote to approve me to go to the village board with these, with to schedule something for the village board to actually give the awards out to these two organizations.
So I'd like to just again reinforce at least one of the points that was made by Mike. You may be aware that pediatric patients, pediatric age group, is one of the under-vaccinated groups throughout the United States. And I've been involved with other organizational efforts to try to get more and more pediatric providers to provide the COVID vaccine, since they, in general, pediatricians and family physicians who practice pediatrics do provide a large number of vaccines, in childhood and early childhood. And so I think it is really nice to recognize a practice that stepped forward early in this pandemic and has been extremely accommodating and as pointed out here, really regardless of the ability to pay. And so I certainly support this, but I think we need to have a vote. And there's a hand I see, Maureen.
You have spoken very eloquently for Heartland, and I agree with you. I just want to speak for Kids First, which was started by Kathy DiVincenzo years and years ago. I knew her when she was a resident. And one of the first things she did in her practice was realize that Orthodox Jewish families, and she's not Jewish, were underserved. So she hired a Jewish physician who was willing to work on Sundays. So her office is open 7 days a week. She was one of the first pediatric practices to include behavioral health providers on her staff. So she has a wonderful holistic practice, and I heartily endorse, besides what she's doing for vaccinating children for COVID, her practice is what every pediatrician should be doing.
Very well put. So why don't we make this simple? Because I don't see the whole group on the screen. And Mike, if you want to go and stop the screen share so we can get everyone on the screen.
Yep. The heck. Oh. Just gotta figure out how to do it. I got it right here.
Mike, I'll be presenting both organizers. One.
They're both. It's for both.
So
Oh,
yes, you have a comment?
I will vote for both of them.
Okay. She says she'll vote for both of them.
Yeah, okay. So what I like to do is I'd just like to actually call, as we said before, we're going to assume that everyone is for this motion, unless I hear or see a declension. Anyone against putting these two organizations forward for this award? Please raise your hand, either electronically or raise it and wave it.
Bring you the thumbs up. That's good. If everyone.
Right, and for those of you that
I'm
do not-
voting yes.
Yeah, okay. And anyone, because there's a number of you that we do not have you visually, so I can't tell what you feel. So just please call out if you're opposed, and any abstentions. Not seeing anyone opposed or abstaining, then the motion has passed, and we will put this forward to the village trustees. Is there anything else you want to do on that issue, Mike?
Nope. That's it.
Oh, that's good. That's wonderful.
Yes, and as I said, I'm very familiar with Kathy's practice, and with Harlan, who has done amazing things throughout the metropolitan area, and I think that when you have providers like this in our community, we should do the best we can to acknowledge this. And I think this is terrific. So at this point, do we have any public comments?
There are no public comments. The last public comment was something James forwarded about something else from earlier today that I could see,
Okay.
but it's not regarding the Board of Health.
Any other business that any member would like to bring forward? Heidi? I think I see your hand. Yes.
Thank you. I would love for us to consider an onboarding for new members of the Board of Health. So one of our roles as a commissioner on the board is to plan, research, and analyze issues affecting quality of life in the village. And I appreciate very much learning about the tons and tons of amazing things that the Department of Health and Human Services does that I'm not aware of. I've been on the board for a long time, and I'm by far one of the newer members of the board, probably. But if we had an onboarding program, we get people up to speed a little faster and can draw on their expertise a little more quickly and learn more specifically what expertise they're bringing, because presumably we're all here because we have some sort of passion for this and some knowledge that we're coming to the table with. And I think our meetings could be more useful to each other and to the village, possibly, if we could bring people up to speed a little faster. And so I'd just like us to consider something like that. I know that we welcome people when they come, and maybe there is an onboarding, more of an introduction to the department than there was years ago. So I'm throwing that out there, and I'd love to be told that it's already being done.
I think it's an excellent suggestion. I know that I benefited greatly by actually asking Dr. Werner a lot of questions. And Mike arrived right around the time that I arrived, and we kind of learned together. And I do have a lot of discussions with Mike offline that most of you may not, who are new members, have that privilege. So I think it is a really good idea. I would like to make a suggestion that if anyone else is interested, maybe working with Heidi and myself and Mike, we can come up with a way of doing this, for the newer members and for people who get appointed in the future. Margaret?
Hi, as one of the newer members, I
You
actually
came on when I did, actually.
I'm sorry?
I think we came on the same time.
Did we really?
Yeah.
Oh, I thought I was newer than you. Well, I apologize.
I just look older.
You certainly do not, actually. But I second that. I think that's Heidi came up with a great idea. I would think we would all benefit as new members with some kind of onboarding process, just to kind of bring everybody up to speed, so that when we go to the meetings, we can kind of contribute a little more and kind of bring a little bit more to the table. I think that would be a great idea.
Yeah, and just as an aside, that was part of the reason why Mike and I decided on a regular educational, what I call board development segment in our meetings, to learn about what goes on, and because it's also there are other departments that we don't necessarily get involved with. They're also doing things that directly impact the health and well-being of the citizens in Skokie. Mike, do you have any questions about this? I saw you light up.
No, I'm sort of nodding my head in agreement. I think that, I think sometimes even I failed to maybe take advantage of this wonderful group. And I think that, I think it's, if I can put together something with maybe Heidi and Dr. Lantern, we'll think of some way to do it. You know,
And anyone else that has any ideas?
yeah, I mean,
I see a couple other hands up too, so I see a subgroup happening.
Yeah, actually, I see it looks like we're gonna have a whole committee.
it's gotta be, I think, 5 or less people.
So did you notice who volunteered?
I'll help you, Heidi.
It's okay. That's the beauty of the YouTube videos. I can go back and look at it later.
All right, so you can, I see Sybil, I know that Bill raised his hand.
But you know what you could do is just have people have Heidi as the point of contact and have them contact her if they're really interested, and then have them develop it.
You know,
Just,
kind of like,
I'll
think I
put
warn
my
you.
contact info. I guess you all have it, but if there's anybody else on the call, I'll put my contact info in the chat, and you know, Mike will take, you know, your leadership on this one for sure. But I just think like these introductions to the different areas of the department could be richer if it wasn't someone's first introduction, if it was an update on the amazing stuff that's happening. So thank you for considering.
Consider it done.
excellent. Any other business you want to bring forward? Not hearing or seeing any, I'd like to call for an adjournment of the meeting. And
Make a motion.
do you want a motion, Larry? You can make a motion.
Yeah, make a motion to adjourn.
I second.
Okay, we'll let you vote by clicking the leave button.
Okay, you got mine.
Okay, thanks, everybody.
Stay healthy, everyone.
You too.
Good night, everyone.
Good night.